Okay, we are talking about love and libido. That's right, you heard me, libido. So what does one have to do with the other? We've got Dr. Angela DeRosa joining us this morning. She is a women's health specialist, and you've got some answers for us. And thank goodness, because today is Valentine's Day.
Absolutely. Happy Valentine's Day.
Thank you, and same to you. So what does love have to do with libido?
Well, it depends on who you ask and at what time in a relationship you're dealing with. But actually, after a certain period of time, they have absolutely nothing to do with one another.
Okay.
But love and libido are fired differently in the brain. So you can still have a high libido and that lust and that ferocity towards somebody and wanting to tear their clothes off and have nothing to do with love.
Just jump them.
Yeah, exactly. And men are actually more wired that way than women typically, but women are kind of evolving in that fashion over the last decade or so. But when you have that love feeling, it's more about bonding, intimacy, emotional connection. And when you talk about sex in particular, the first year of a relationship, women are typically wired chemically in the brain to have that lust and that libido along with love.
So the over the top.
Right. So, but then once you hit that year point, our chemical structure switches and we go to a more an oxytocin bonding where the love really kicks in and the libido may start to drop off, which can be a little bit discerning to a lot of relationships.
Well, and how can you boost your libido?
Well, it depends on where you are in your lifestyle. So, for instance, if you are going through perimenopause or menopause, hormones can have a certain wreak havoc on our libido. Or if you have high amounts of stress or going on, or if, let's say you're pregnant and concerned about nesting and caring for a baby, there's often fear associated with having sex from the man's standpoint with the partner. So you got to really look at where the person is at from an environmental and a personal and psychosocial standpoint, and also making sure there's no medications and certain things that can really douse water on that fire.
And then for the couple that has been married, let's say 20, 30, 40 some years, how do you keep the love alive?
Well, oftentimes people say, well, I love my husband or I love my wife, but I'm not in love with them. And unfortunately, we need to be careful about that because that's more talking about lust and sexuality. And people often think, well, if I don't lust after my partner constantly, that I must not be truly in love with them and maybe there's problems in the relationship. But that's not always true.
Do you think women find that? Like all of a sudden I'm not feeling the same. And it's like I love my husband. I would never leave my husband, but it's like where's the
passion.
Like, the passion. It's like the sizzle's kind of gone.
Well, certainly as we get to know each other and we know all the warts about one another, that passion can somewhat dwindle. When that's
the pros
important.
And the cons.
Exactly. Well, it's important to bring in some spice into the relationship too. And not that I suggest that a date night is always the best answer to all problems in a relationship, but also making sure, again, the hormones are balanced, that testosterone's up and firing it. But if you get all those things are all right, then you want to kind of bring some fun things into the relationship. And I brought just some smattering of toys
bring some
to
fun
play
things
with.
this morning.
And just even women in particular, we're ruminators. We want to control everything.
We're ruminators,
And we multitask all the time. So sometimes just to be able to take all that out. So sensory deprivation, closing the eyes so that you can't see what's happening. You make things feel a little bit better. So even
Zoom in on this.
It's just a little eye mask to cover the eyes, and then maybe introduce some things that are sensual to the body. And touch and tactile is really nice for women. So even you don't have to get kinky or S&M, but certainly the soft feathers on the skin can be nice, or if you want a little rougher, just the different senses. Also, we have you can have a pizza cutter to create like a little bit of
a pizza cutter
on the skin. It's another tactile sense that can be erotic for a lot of patients and women. Certainly having just low-level bondage. You don't have to get into the kinky handcuffs, but just there's some tapes that you can purchase at any of the stores like Fascinations and lightly bond so that there's still that ability to break free if you're getting uncomfortable. And some women, certainly there's some eroticism to having nipple clamps. So the nipples are very sensitive. Some women can actually have orgasms from just nipple stimulation alone.
Look at that.
And then personal massagers, which have the vibratory sense that can be all over the body, not just for the erogenous areas. And certainly soft things. I mean, just bringing small things into the bedroom just to kind of bring that intimacy and kind of lustful sense, but I think women really want someone maybe to potentially take control because we're in control all day long.
So who introduces this? I mean, in the relationships, is it more of the woman that says, hey, honey, all right, let's, do something, let's try a little something out here tonight, or is it more of the man?
Well, I think men typically, and we often bag on them quite a bit, but they really do want to please their partners. And unfortunately, they're often afraid to ask for what they may want, or you may be afraid to ask for what you want. There's so much lack of communication about sexuality between partners. And often if you just talk freely, we find out you both want similar things.
Similar things.
But even just starting small, just bringing one or two of these things into the bedroom, say, hey, honey, I have something new to try
just
tonight.
Have fun, even though you're both like kind of giggling and laughing, but hey, that was kind of neat and different.
I mean, we see each other naked in bathrooms in the most precarious situations and with bathroom habits and different things. Why can't we talk about sexuality openly? But if you're a little uncomfortable, just kind of bring it in and see what happens.
Slowly but surely. And what about food? Can that help boost the sex drive?
Absolutely. There's some foods that are known aphrodisiacs.
Ooh.
Oysters, champagne. Our personal favorites, chocolate, is known to boost that. Bring those into the bedrooms. Chocolate-covered strawberries, maybe feed them to the partners. Also, scents are very powerful. People often remember, say, certain vanilla scents or different things to an early relationship. That can be also very powerful.
And quickly, I know you have written a book, which is, this title is very eye-catching, How Your Doctor is Slowly Killing You.
Yes.
And just give us one quick tip about this book.
The book is not saying that doctors are bad or nefarious, but certainly that there's a lot of things that we do unintentionally to women in particular that can kill their hormones in their body, which not only can affect sexuality and libido, but also medically cause a lot of damage with heart disease, et cetera, and those things. So you need to know what you're doing when it comes to medications.
Okay, and we will be able to pick that up. Thank you so much for
you're
joining us
welcome.
and for spicing up
Pat, I'm coming
Valentine's
for
Day.
you.
There you go. Dr. DeRosa, everybody. We'll be right back.